Hi, welcome to another one of our Dr. Foot videos. Sorry, I'm just enjoying my coffee and completely forgot, of course, for a couple of seconds that I was making a video. I'm going to be talking to you today about verrucas. Now, I have made a couple of other videos about verrucas, but I think I need to revisit this topic because I see so many patients with verrucas. Those of you that don't know, verrucas are caused by the human papillomavirus. You often can acquire them, I would say, rather than catch them, because you're not really catching them. Acquire them from changing areas, swimming baths. When your feet are wet, it gives an ideal portal of entry into the skin. They can lie dormant for such a long time and then they start to spread. There's a couple of different varieties of the HPV virus. HPV1 is the most common that we tend to see in clinic. They can be quite large. You can have them anywhere on the foot. Most common places are on the ball of the foot or the heel. They can be quite painful and they can be difficult to treat. Now, yesterday I saw a mother who had verrucas and she brought her 6-year-old daughter who also had verrucas. I'm going to be a little controversial here and there's not a great deal of evidence to back up what I'm saying, but I think verrucas are related to immunity. I think that some patients are more prone to them because the HPV virus is more stronger in certain individuals and certain families. That's what I have found. I have found that certain patients who are more stressed out, they tend to get verrucas quite quickly. People that have a poor diet. Now, it's not always the case. You could be the most zen-like person in the world and eat the most healthiest food. At the moment, we've got this vegan January going on. I'm not a vegan. I quite like my meat, so everybody telling me I should be a vegan for January is like, stop. Anyway, back to verrucas, because I shouldn't be talking about food and verrucas in the same video, but nevertheless, back to verrucas. These two patients that I saw, I advised them completely different types of treatment. So I had the mother and the daughter coming. With the daughter, the 6-year-old, she had a small cluster of verrucas. Now, I tend not to treat them in children under the age of 10. I will leave them alone. And any parents listening to this, leave them alone. They will 99% of the time just go on their own. Just cover them with the plaster. So especially if the daughter or the son likes to swim or likes to do any football activities or rugby or whatever sport that they play and they're in a changing room, just cover it with the plaster, and it will normally go on its own. What I then tend to do, if it doesn't go on its own, I may give weak acids. However, I'm very careful in telling the parents to make sure you only put it on the verruca and not burn the healthy skin around it. So many parents I know that have burnt a hole, not really a hole, but so much of the healthy skin around the verruca itself. I don't have to tell you, that's not a great thing to do. So it's important to visit a podiatrist, any podiatrist, have them pare down the verruca with a scalpel. It doesn't hurt, and then they will tell you exactly where the verruca is, and the podiatrist will recommend a suitable acid. I will start off with the weakest acid that I possibly can. Maybe as the child gets older, I may do a different kind of treatment, like freezing it. So I might use liquid nitrogen and freeze the verruca. It's called a cryotherapy. Can be effective. It's not so effective in adults. Well, I don't think it's effective in adults. So that's what I recommended to the mother for her daughter. I said, leave it alone. Don't touch it and it will go away. And if it's not gone away after a certain amount of time, then come back to me and then we will address it. With the mother, however, she had a cluster of verrucas. She's tried everything. The bazooka, the verruca gel, which I think should be banned. The amount of patients I've seen that think they have a verruca, they don't. They apply the bazooka, the verruca gel, which is a strong salicylic acid, burn a hole in their toe or their foot, and they come to me with an infection. Unbelievable, unbelievable. yeah, as you can tell, I'm quite passionate about patients not being able to apply strong acids. But anyway, this patient has applied Bazooka the Verruca. She's had a couple of other treatments. She's had cryotherapy. She went to a podiatrist in London actually, and she had verruca needling. Verruca needling is something I like to do as well. So we give an injection in the foot, we take a sterile needle and we needle the verruca, and the ideal is to reintroduce the virus back in the body. Has about 60 to 70% success rate, and I really like it. But however, it didn't work with her. So she came to me and she wanted another option. So she said, "You're the verruca man, give me some other ideas." First of all, I thought, it's not a nice thing to call me the verruca man. I'd rather be called the brand George Clooney, but I'll take it, I'll live with it. So what I recommended for her was the Swift microwave treatment for verrucas. Now, Swift microwave treatment for verrucas has slightly higher success rate, so we're talking about 70 to 80%. Does still mean there's 20 to 30% of people I can't get better with this, then I've got to send them to a dermatologist. But I have a very high success rate with doing Swift on patients who've had verrucas for some time. They've tried other treatments and it hasn't gone. With Swift, you have to come in for 3 treatments every 3 weeks apart. It is painful. So, however, the pain only lasts for less than a minute. And then once you're off the chair and the treatment's finished, there's no pain. It's stopped. And it's trying to get that mindset of the patient that this pain is going to be for a very short time, and once it's done, it's done. It's less than a minute actually. So we apply the Swift treatment for 2 seconds, and we do that 5 times at a minimum. So it's not very long at all, 10-15 seconds, but during that time it is painful. But you can leave without any dressings. You can go about your normal day and you'll be perfectly fine. I've got the sun shining on my face. I think I've got God smiling on me. Well, in my head I've got God smiling on me. So that's the Swift treatment. Later on today, I've actually got a couple of patients booked in for Swift. So if they say yes, I'm going to record it and I'm going to show you how I do the Swift treatment. But she's booked in for a Swift treatment, so she had no contraindications for the Swift treatment, and I think she will be a suitable candidate, and I think it'll be quite effective for her. Hope you've enjoyed this video. If you have any questions about verrucas, ask. Drop us a message, DM us, drop us an email, go to our website, send a white pigeon with a little note on it. I'll try and get back to you. And have a wonderful day. Take care. Bye. You ready?
Yeah, I'm nervous.
You're nervous? You've had this before?
I know.
In fact, let's change this up a little bit. Here we go. First one. How was that? Was that okay?
Yeah.
Yes, you won't feel the first one. Number 2.
Oh, God.
Did you feel that?
Tiny bit.
Okay, this is number 3. This is the one that you normally feel. Okay. Is that okay?
Fine.
That's good.
Fine.
Number 4. Okay, one more and you're done on this spot.
Okay.
Here we go.
1.